Fibrous dysplasia is an orthopedic disease condition. Look at this X-ray, hip joint, femur, and skull X-ray to revolve characteristic ground glass appearance of bones and CT scan, MRI to assess extent of bone involvement and complications. Look at this findings. Detail going on. Introduction. Fibrous dysplasia is a rare, non-inherited bone disorder characterized by the replacement of normal bone with fibrous scare-like tissue. This results in weakened bones, deformities, and fractures. The condition is caused by genetic mutation affecting bone development, leading to abnormal bone growth and structure. Definition. Fibrous dysplasia is a skeletal disorder in which normal bone is replaced by fibrous connective tissue, leading to structural weakness, deformities, and an increased risk of fractures. It can involve one bone, monostotic, multiple bones, polyostotic. Etymology. The term fibrous dysplasia originates from Latin and Greek roots. Fibrous refers to the fibrous connective tissue that replaces normal bone, and dysplasia comes from the Greek word dys, bad or abnormal, and places, formation or growth, indicating improper bone development. The condition was first described in medical literature in the early 20th century, with its name reflecting the abnormal fibrous tissue proliferation within bones. Types. 1. Monostotic fibrous dysplasia involves a single bone commonly affecting the ribs, skull, or femur. 2. Polyostotic fibrous dysplasia affects multiple bones, leading to widespread skeletal abnormalities. 3. McCown-Albright syndrome, a severe form of polystotic fibrous dysplasia associated with skin pigmentation and endocrine abnormalities. Causes: fibrous dysplasia is caused by a mutation in the GNAS1 gene, which affects the function of osteoblasts, bone forming cells. This mutation leads to abnormal bone formation and prevents normal bone maturation. The main causes are 1. GNAS gene mutation, primary cause. 2. Somatic non-inherited mutation during embryonic development. 3. Increased CAMP signaling affecting bone formation. 4. Impaired osteoblast differentiation. 5. Abnormal fibrous tissue proliferation replacing normal bone. Risk factors: 1. Genetic mutations, though not inherited. 2. No known environmental or lifestyle risk factors. 3. May occur spontaneously during fetal development. Complications: 1. Bone deformities, example bowed limbs, facial asymmetry. 2. Fracture and bone pain. 3. Nerve compression leading to vision or hearing loss in skull involvement. 4. Endocrine disorders associated with McCann Albright syndrome. Pathophysiology: the GNAS1 gene mutation leads to increased cycle AMP levels, disrupting osteoplastic differentiation and function. The result in the replacement of normal bone marrow with fibrous tissue, impaired bone strength and mineralization, causing deformities and fractures. Pathophysiology of fibrous dysplasia, step by step process. 1. Genetic mutation. A somatic non inherited mutation occurs in the GNAS gene, leading to abnormal activation of the GAS protein. 2. Increased CAMP levels. The mutation causes continuous stimulation of adenylate cycle, leading to excessive production of cyclic AMP in affected bone cells. 3. Disrupted osteoblast differentiation. Elevated CAMP interferes with normal osteoblast bone forming cell maturation, preventing them from producing normal lamellar bone. Instead, they remain in an immature state. The fibrous tissue proliferation, the defective osteoblast produce excessive fibrous connective tissues and immature woven bone, replacing normal bone structure. 5. Expansion and weakening of bone. The fibrous tissue and immature bone create poorly mineralized, structurally weak bone, leading to deformities, fractures, and bone pain. 6. Formation of lesions. The affected bone develops fibro-osseous lesions which appear as radiolucent, which means ground glass areas on X-rays due to their abnormal composition. 7. Possible endocrine and skin involvement in McCann-Albright syndrome. In some cases, the same GNAS mutation affects endocrine tissues, causing hormonal imbalances and can also lead to the cafe AU light skin pigmentation. This progressive process results in the characteristic features of fibrous dysplasia, including bone deformities, pain, and fractures. Signs and symptoms: 1. Bone pain. 2. Swelling or palpable mass in affected areas. 3. Frequent fractures. 4. Bone deformities, example bowed legs, facial asymmetry. 5. Cafe AU light skin pigmentation in McCann-Albright syndrome. 6. Endocrine abnormalities, example early puberty, hyperthyroidism. A diagnosis: 1. Medical history and physical examination evaluates symptoms, skeletal deformities, and associated conditions. 2. X-ray reveals characteristics, ground glass appearance of bones. 3. CT scan and MRI assess extent of bone involvement and complications. 4. Bone biopsy confirms diagnosis by analyzing tissue samples. 5. Genetic testing detects GNAS1 gene mutation in suspected cases. Nursing diagnosis. 1. Chronic pain related to bone deformities and fractures. 2. Impaired physical mobility related to weakened bone structure. 3. Risk for injury related to fragile bones and potential fractures. 4. Altered body image related to deformities and functional limitations. 5. Knowledge deficit related to disease process and management. Medical management. 1. Pain management, NSAID, analgesics, bisphosphonates to reduce bone turnover and pain. 2. Fracture prevention and treatment, immobilization, orthopedic interventions, and physical therapy. 3. Hormonal therapy if associated with endocrine disorders. 4. Surgical intervention, bone grafting, corrective osteotomies, and fixation in severe deformities. Nursing management. 1. Pain assessment and management. Monitor pain levels and administer prescribed medications. 2. Mobility assessment. Encourage the use of associative devices to prevent falls and fractures. 3. Patient education. Teach about the disease process, lifestyle modifications, and treatment adherence. 4. Emotional support. Address psychological concerns related to body image and mobility limitations. 5. Monitor for complications. Regularly assess for signs of fractures, deformities, and neurological involvement. Treatment options. 1. Medications. Bisphosphonates, example pamidornate, zoledronic acid to strengthen bones. 2. Physical therapy to maintain mobility and prevent muscle atrophy. 3. Surgery for severe deformities, fractures, or nerve compression. 4. Orthopedic devices, braces, and supports to improve function and prevent fractures. 5. Hormonal therapy if associated with endocrine disorders. Psychosocial medicine. 1. Counseling and support groups helps patients cope with chronic illness and body image issues. 2. Cognitive behavioral therapy, CBT, assist in managing chronic pain and emotional distress. 3. Education and self-care training empowers patients to manage symptoms and prevent complications. 4. Social integration programs encourages participation in activities to improve quality of life. 5. Family support and involvement encouraging family members to provide emotional and physical support. Prevention. Since fibrous dysplasia is caused by a spontaneous genetic mutation, there are no specific preventive measures. However, patients can adopt strategies to minimize complications. 1. Maintain bone health with calcium and vitamin D. 2. Engage in low impact physical activities. 3. Avoid high risk activities that increase fracture risk. 4. Regular medical follow ups for early detection and complications. In conclusion, fibrous dysplasia is a rare and complex bone disorder caused by a genetic mutation. While there is no cure, medical and surgical interventions can help manage symptoms and improve quality of life. Multidisciplinary care involving medical and psychosocial support is essential in ensuring optimal patient outcomes. Continuous research is needed to develop better treatment options for individuals affected by this condition. Thank you. Have a nice day.